Okay, this is recording number 4 on our volumes distribution and protein binding discussion topic. And this one we're going to talk, we've already talked about the rate of distribution by talking about transportation through a membrane. So we talked about passive diffusion as well as carrier-mediated transport. And then we talked about permeability limited versus perfusion limited models to get drugs, transportation of drugs to the organ. And now we're going to talk about, we're moving from rate of distribution, where it tells us how quickly a drug is going to move places, to the extent of distribution. So how quickly or how extensive and where is this drug going to go and where is this drug not going to go. So we're going to, in this video, talk about central volume of distribution primarily, and then we'll eventually get to VD, which is apparent volume of distribution, and then steady state volume of distribution. So we're going to start off by talking about central volume of distribution. Oops, I should have had this slide going, sorry. All right, the central volume of distribution is really simple. I think of just there being a beaker or some sort of container, and you've got this container here that will be your body, let's say your patient's body. So this is the body. It's all one compartment, which is very unlikely, but let's just say it's all one homogeneous compartment, and the drug will come in here and distribute. So that would be a one compartment model. Now the central volume of distribution is that piece of the patient where the drug will initially distribute. So when we give a drug IV, for example, by IV bolus, what volume does the drug initially go into? So this usually includes the blood and all the highly perfused organs like the heart, the lungs, the liver, the kidneys. So, and then it'll eventually move out into the fat stores, into the muscle, into the bone, and those would be not considered your central volume. The central volume is where it goes initially. So this is how we use this volume of distribution when we're determining a loading dose. So this LD stands for loading dose. So if we want to determine a loading dose, we use our central volume of distribution, or that initial volume of distribution, and then we put in here what our target concentration is for that volume of distribution to determine our loading dose. This is important because we don't want to use our eventual volume of distribution, so the volume of distribution at steady state, because then it's going to distribute into maybe a much larger volume. Do we want to calculate our loading dose, that initial dose, based upon where the drug will go eventually? What would be the risk here? Well, the risk here would be that we would have too large a loading dose and the concentration would be too high, because we're using a volume much larger than where the drug is actually going to go to begin with. So if we're trying to determine a loading dose, we use that central volume of distribution to determine our loading dose. And if we're giving an IV bolus of a drug, that concentration that we get right away with that IV bolus would be dependent upon this volume of distribution, your initial volume of distribution or central volume of distribution. Now, apparent volume of distribution. Apparent volume of distribution relates the amount of drug in the body to the achieved plasma concentration. So volume, in this case, you take your amount divided by concentration. So it would be the amount of drug in the body at equilibrium divided by the concentration that we get. So we can also calculate it by using that relationship between volume, clearance, and K. This is just a rearrangement of that K, clearance, and volume equation. So we can calculate it by dividing K into clearance to get our apparent volume of distribution. Now, for the drugs that we have thus far, volume of distribution will range between 0.04 liters per kilogram to 600 liters per kilogram. So think about that, 600 liters per kilogram. So if we have a normal size person, a 70 kilogram person, and we have a drug that's distributing into 600 liters per kilogram, that would be 42,000 liters. So the volume of distribution of the drug would be 42,000 liters. So think about what that would be like, 42,000 liters. So if there's about 4 liters in a gallon, that's more than 10,000 gallons would be the volume for this large drug. How is that possible in a 70 kilogram person? Well, I'm going to try to explain it to you. This is why we call this the apparent volume of distribution. So here's my little analogy. You know how I like to tell stories to try to explain concepts. So here's an oil well analogy. So I want you to pretend it's getting to be spring out now, and let's say your house, you decide you're going to dig a little garden, you're going to grow a few flowers, maybe a few herbs and vegetables this spring. So you're digging out in your garden and you discover oil. This is oiler country. There was natural gas and oil all over around in Findlay and in this area. So you're digging in your garden, and up through the ground comes a bubblin' crude, which is a song from Beverly Hillbillies, and you guys are way too young to know Beverly Hillbillies. But Beverly Hillbillies, there's people from the hills that discover oil. They become really rich, and they move to Beverly Hills, and hilarity ensues. But anyway, so you discover oil and you decide, woohoo, I'm rich. I don't have to go to pharmacy school anymore. I'm going to go in and quit my classes right now. And but first you figure I better determine how much oil is in that well so that you can decide if you're going to quit pharmacy school yet, or how you're going to spend your money, if you're going to buy a new Tesla or something. So how will you figure how much oil is in this oil well that's in the ground? Well, you're a good chemistry student, so you know if you add a known amount, a known weight of oil miscible dye, that'll be your amount, and you can put that into the well and mix it up until it reaches an equilibrium. Make sure it's well distributed. So let it come to equilibrium. And once you mix up that oil, you take out just a little sample of that oil to determine the concentration of the dye in that oil. Okay? So once you measure the concentration, concentration you all, I'm sure, understand, is amount divided by volume. So if we put units on that, the concentration would be in grams per liter if the amount were in grams and the volume were in liters. So if we know that we put in a known amount, right, and we can measure the concentration, we can solve for the volume, which is what we want to know. We want to know how many liters of oil we have. So if we rearrange this, volume in liters will be equal to the amount of dye we put in and the concentration of that aliquot, right? And then we'll end up with our volume. Everybody good with this? Okay. So you calculate the volume and you are rich. You pump out the oil, but it's much less than you had calculated. Uh-oh, you better run back to to Dean Parker and ask if you can get back in the pharmacy program if you've already quit. Why would that be? What happened? So here's your oil well. Notice there's all of these are supposed to be rocks. So here's your oil well, and here's where you dug around up here. But there's all kinds of rocks here at the bottom of the oil well. And those rocks will bind up your dye. if those rocks are binding up your dye, what's going to happen? Well, a lot of the concentration, or your concentration is going to be more dilute than it really should be to represent the volume, right? Because the drug is all stuck there, so you're going to overestimate your volume. If we go back and look at this equation, your concentration is going to be much less than what it should be if it were just a beaker, right? Because you've got drug that's bound, or I'm sorry, you've got dye that's bound to the rocks. So your concentration is much less. Therefore, your volume is going to be overestimated. Okay, sorry. All right. So those rocks in the oil well are a symbol for protein in your plasma and protein in your tissues that can bind drug. Therefore, drugs, an apparent volume of distribution of 600 liters per kilogram is an overestimate of the actual volume that the drug is distributed into, because that drug, is a drug called amiodarone, is very highly bound to tissue proteins. So it gets stuck in the tissues, and therefore the concentration is decreased, and your volume of distribution is way overestimated. That's how you can get a 600 liter per kilogram drug. Thank you. See you on the next one.